Good evening, everyone. Welcome to another Golden Conversations. Thank you all for joining us for this another exciting conversation that we will have as it pertains to healthcare and just taking care of our senior citizens, the one who we love, who have cared for us to make us whom we are today. And invite your friends, invite your relatives, tell them to come in and join. And thank you for those who are already on the live. The numbers are going up already. Thank you so much for the early viewers. We appreciate your company. With us today is Miss Sharon Jones. Woo! She is the Health Promotion and Public Relations Manager at the National Health Fund. So that says it. We'll be talking about the National Health Fund and how seniors can benefit through the fund to alleviate some of the medical expenses. So without much further ado, jump right into it. Miss Jones, how are you doing?
I'm doing wonderful. Thank you so much for inviting us, Shelly Ann. It's a pleasure. It's always a pleasure to talk about the NHF services and especially to our senior citizens.
Okay, awesome, wonderful. First of all, just in case there are persons who are living under a rock and not sure about this great organization that does so much work for our people in the health sector in Jamaica, give us an overview as to the work of the National Health Fund.
Okay, thank you so much. So we continue to promote the National Health Fund as we would like everybody to be aware of the services and benefits that we offer. So the National Health Fund is an agency of the Ministry of Health and Wellness. And we were basically established to alleviate some of the financial burden on our health system. And in one way, by doing that, is through the individual benefits program. And the individual benefits program is where persons access their NHF card. So one way in which the NHF assists the health sector in alleviating the burden on the health sector is through the NHF card. And what I want to inform your viewers today is that the National Health Fund card covers 17 chronic illnesses. And today I am in purple because today is observed as World Lupus Day. And lupus was one of the latest chronic illnesses that we added onto our NHF card program. Lupus was added in 2019. So today there was a big commemoration just to inform persons of the benefits and encourage persons living with lupus to sign up for the NHF card. So we cover 17 chronic illness. I don't know if we'll have time to list them now.
It would be nice, sure, especially to go through the major ones.
Okay.
Is there the big C? It covers the big C.
Right. So what I should do, Shelley, was to do a little question and answer. But the 7 chronic illnesses, I will just touch maybe the top 10. We have arthritis, we have asthma, we have breast cancer, we have diabetes, we have epilepsy, we have glaucoma, high cholesterol, hypertension, ischemic heart disease, lupus, which I mentioned before, major depression, prostate cancer, psychosis, rheumatic fever, heart disease, sickle cell, and vascular disease.
Wow.
Those are the 17 chronic illnesses that the NHF card covers.
And you did mention a number of non-communicable diseases that affect a number of our senior citizens. Arthritis, as you mentioned, hypertension.
Yes.
Those are common illnesses among our elderly population. So when you say the NHF card covers these 17 illnesses, what exactly do you mean? Can I take my card to the doctor? Can I take it to the pharmacist? What does covers mean?
Okay, so the process is once the NHF card is eligible for Jamaican residents, all right? And it's regardless of your age, it's regardless of your socioeconomic status. So it doesn't matter if you're rich or you're poor or you're in between. And it doesn't matter if you're young or you're old, as we're talking to senior citizens now. Once you're diagnosed with any of the 17 chronic illnesses, what you will do is that your doctor will fill out an NHF form to indicate
Mm.
that you are diagnosed with any of the illnesses. Once the doctor has filled out that form completely, indicate the illness, there's a section on the form that he will tick to say, okay, you're diagnosed with arthritis, and he signs it and inserts his registration number. That card, that form is completely filled out. The individual will take that form to the National Health Fund customer service locations. We have 21 NHF card locations island-wide. You take that form to us, and we will issue an NHF card. And the process is very quick. We usually process the card in less than 30 minutes. So if you visit the
Mm.
doctor today and the doctor said, boy, you know what, you need to go on this medication because you're diagnosed, you take it to our location today and you will walk out with NHF card today.
Wow.
Once you have that card in your hand, you can take it to a private pharmacy. Now I will explain a little bit more about the private pharmacies. You will take it to a
Mhm.
private pharmacy and you hand in your prescription along with the
Right.
NHF card. And what it does is that it provides you with a discount on the cost of your medication. So in the end, you will pay less for your medication. So when we say subsidize, is that it discounts your cost on your medication, so you pay less for your medication. And what I also
Mhm.
need to point out is that the National Health Fund card can also be used with your private insurance. So what we found, Shellyan, is that a lot of persons who have private insurance, they tend to leave the NHF card in the drawer or at home and say, I don't want to use that. But it is prudence. It is financially prudent for persons to use both cards because you will get the initial discount with the NHF card, and then you will also benefit from your private insurance. So you end up paying less for your medication.
Okay. All right, I want to backtrack a little bit. You said once you go to the doctor can fill out the form, then you take the form into your office and you get the card. Is there a cost to get the form?
No, the form is totally free. The form is on our website. It is downloadable. Also, the forms are usually at hospitals, health centers, doctor's office. So once you visit your doctor and you're diagnosed, your doctor will it's like a second nature for medical doctors in Jamaica to refer persons to the National Health Fund program.
And there is no cost for the card either.
No cost for the card. That's a provision that the government of Jamaica provides for its citizens, because
Okay.
at the end of the day, we want persons to be able to not feel so burdened about their medication, so they can, even though a diagnosis may be traumatic or sudden, the government puts in the provision to say, okay, we will assist you with purchasing or getting your medication so you can manage your illness better and continue to be productive.
Awesome. So let us talk now about the age limit. Is there an age limit to getting the card? Because we're
No,
talking
not
about
at
seniors here.
no, not at all. There's no age limit. It's from birth to seniors. As long as you're alive, you can get the NHF card. And the NHF card, also I need to point out that it does not expire. So as long as your card is in good shape, good form, you can use
Mhm.
it.
Okay, you did mention something very important that we can use it as well with private insurance. So let's now talk about the financial benefits of the card. What amount does it cover? What percentage does it differ per illnesses? How can someone really and truly save financially by having an NHF card?
Well, the discount or the subsidy that is on the NHF card is not a percentage, it's a fixed amount and it varies. I was looking at the subsidy provided for, say, lupus today, and for one injectable, the subsidy was like $61,000 on it. That's a discount a person will get if they're on that medication. And for illnesses such as cancer, we have extremely high subsidies on those as well. But it varies and it's a fixed amount. But we've gotten a lot of commendations. Persons will screenshot their medication costs and send it to us and say, look at this discount that I got with using the NHF card as compared to not using the NHF card.
Okay, and it's also applies at the hospitals, private hospitals, public hospitals. I know we mentioned pharmacies and drugs. So let's now talk about medical care.
Okay, so you have shifted into another particular program. So we will once you're diagnosed with the 17 chronic illnesses, anyone you can access the NHF card and you can use it at a private pharmacy. Okay, especially for our senior citizens. Well, and if you are using the public health system, so if you're accessing care at the hospital or health center, the medication is free of cost at the drugstore pharmacies. So the National Health Fund manages over 110 public pharmacies. And if you're being treated at a public facility, you will get your medication free. So I really want to emphasize this because a lot of persons are not utilizing the benefits that are out there. So once if you're an inpatient, of course you'll get your medication. If you're an outpatient and you visit the hospital for checkup, you fill your prescription right there at the drugstore pharmacy and it is free of cost. Once the medication is on the what we would call a vital, essential, and necessary drug list, which the government is approved. And a lot of medication, most of the medications are actually on that list. So once the medication that you're being treated for is on that list, you'll get your medication free of cost.
Okay, great news. And just to go back to something that you brought up, there are 21 locations that seniors can access the cards. They can fill out the forms or drop off the forms and they can get the cards. So we're talking now about rural Jamaica.
Yes, the NHF card centers are located island wide, and they're particularly located at the health facilities. So in Kingston here, our head office is at Dominica Drive in New Kingston, but the card centers are mainly located at the major hospitals across the island. So if you're located anywhere in the parish, you can visit one of those major hospitals and you can drop off your application form at the drugstore pharmacy and your card will be processed on the same day. So I mean I can list out a few of the locations. Of course, I mentioned the head office.
Right.
We also have a major location at Union Square in Crossroads. Cornwall Regional Hospital. We have St. Anne's Bay Regional Hospital, Mandeville Regional Hospital, Maypen Regional Hospital, Greater Portmore Health Center. That's also a major location.
Okay.
KPH, Princess Margaret Hospital in St. Thomas, Percy Junior Hospital, Port Maria Hospital in St. Mary, Santa Cruz Health Center, Black River Hospital, Port Antonio Hospital, Noel
Mm-hmm.
Homes in Hanover, Falmouth Hospital, Savla Mar, Linstead Hospital in St. Catherine, Lionel
Okay.
Town Hospital in Clarendon, and the Spanish Town Hospital. So those are our card centers locations.
So the eastern, northern, southern, western, everywhere is covered.
Yes.
Wonderful. We have a question coming in from one of our viewers, Miss LaShawn Douglas. She wants to find out if the same amount for a subsidy is provided every time you need a medication.
Okay. On a particular medication, the same subsidy will apply. The same subsidy would apply on that specific medication. And what I wanted to invite your viewers to the National Health Fund website, where we have the entire subsidy list online. So
Oh,
persons can
awesome.
go online and look at the specific um, um, value amount, dollar amount that they're getting on their medication.
And the website would be NHF.
Right. Our website is www.nhf.org.gm.
org.jm. Awesome. But just to pick up on LaShawn Douglas' question though, when she says every time they need a medication, so if seniors have to purchase the same medication every month, it would be the same subsidy each time they purchase the medication?
Well, I'm glad you've dovetailed into the seniors, because seniors are seen very special, and there are special provisions made for seniors. So
Mm.
what I want to inform your group today is that the JADE program, which was established back in 1996 by the
Mm.
Ministry of Health, it makes special provision for our senior citizens. So persons who are 60 years and older, if
That's
you're
our
on
age
the
group, yes. 60 and,
right, if
and,
you
and
are,
older. Yes,
yes,
yes.
60 years and older, if you're on the JADE program, you get 100% subsidy on your Medicaid.
Mm.
So I
That's
see,
all medications, Miss Jones?
once it is on the approved drug list,
Okay, okay,
right?
okay.
And um, what the senior citizens are asked to pay is just a service fee of $40. And I've experienced it myself. I use my mom's JADEP card to purchase her medication, and every 3 months, and you pay $40 just for the service fee for one item. And if it is 6 items, you pay
Mm-hmm.
$240. The maximum a senior citizen should be paying for medication once they're on the JADE program and the prescription drug is on the government approved list, you are to pay $240 for your medication.
Wow, wow. And the JADEP is JADEP? Remind me.
Yes, so JADEP stands for Jamaica Drug for the Elderly program.
Jamaica Drug
For
for
the
the
elderly program,
Elderly Program.
right? I
And
must,
they can get access to this card in terms of filling out the lovely forms you told us about earlier at those same locations, island-wide, the 21 locations.
yes. So I wanted to inform your listeners of two areas before we move on. So for the JADEP program, of
Mm-hmm.
course, the process is the same, that the doctor will diagnose you, and you will take in the application form as you mentioned. And once you get that card, and I will speak about some new happenings at the National Health Fund later, because we have
Ooh,
improved our services over time.
lovely.
Once a senior citizen gets the NHF card, previously we would issue two cards, but now it's the NHF card. You would go to the
Okay, so
front.
the NHF card now covers for JADEP as well.
Yes,
Commendations.
That's my good news sharing. My what's new?
Commendations to the team. Because as
Yes,
seniors, to be
thank
walking around with so many cards and trying to get the different forms filled out, that is just
ex-
too tedious.
exactly. So we have one form
Wonderful
now,
work,
and we have
NHF.
one card.
Okay, okay. So,
Right.
what about
So
persons who would have already had the NHF card or the JADEP card? Do they need to renew it or they just keep
no,
going?
they just continue using the NHF card. They just continue using the NHF card
Okay. So, what about our elderly who would have had the JADEP card
only.
only?
They can continue using the JADEP card as well. We encourage persons to upgrade to get the NHF card, but they can continue because we don't want to put any additional pressure on our senior citizens to to get new cards. But they can continue using their JADEP cards. But we still encourage them to, if they want to switch out and get the NHF card, it's no problem.
Okay, great. So, one final question on the amalgamation of both cards. So, for the JADEP card, that would also covers the 17 illnesses of the NHF card.
So for the JADEP card covers 10 chronic illnesses. All right.
Mm.
So if you have if you had the JADEP card only,
Mm-hmm.
you would have that card would cover 10 chronic illnesses, and those
Oh,
medications and the 10 chronic illnesses will be free to our senior citizens.
mm.
Right? So now what happened is that, take for instance, you have a senior citizen that had both two cards. They would get the benefits from the extended 17 chronic illnesses as well as the JADEP drugs
Okay,
as well.
okay. Because those 10 illnesses would have been covered under the 17 of
Yes,
the NHF card.
yes.
Okay, great. And now with the amalgamation of both cards, the JADEP now covers 17 illnesses instead
Yes.
of instead of 10.
Yes, instead of right. So they will get once they're diagnosed, remember they have to be diagnosed with the condition first.
Mm-hmm.
So if they're
Mm-hmm.
diagnosed with the 17 chronic illnesses, they can also access it with the card.
Okay. And we're encouraging our seniors to get the NHF card.
Yes, we are encouraging our senior citizens to get, if you have a JADEP card only, you can upgrade to the NHF card. If you have
Mhm.
both cards, you can just use the NHF card alone and you'll get both benefits.
Wonderful, wonderful. Great news. Thank you for bearing lovely gifts for us, Miss
Yes,
Jones.
right. I'm very happy to share that because we've heard the concerns of our clients, and that's one of the major areas with the National Health Fund is that we try to improve our services to serve our clients better. And I saw a question pop up before I move there.
Before-
I need
Okay.
to inform your viewers that
Miss Donaldson's question, I was going to ask that as it pertains to both cards. Okay.
yes, yes,
Okay.
right. But what I wanted to find out is that especially for this group, we usually emphasize that when you go to the pharmacy, please ask the pharmacy if they are on the JADEP program. So it's not
Mm.
all pharmacies island-wide, they're on the JADEP program.
Okay, so
So
we're
you
now
have,
addressing Miss McDonald's question that speaks to sometimes these $40 drugs are not available and they're very expensive.
otherwise, what
So,
we usually ask the persons to do is, if right, so one thing to be clear is that you have to ask the pharmacist if they're on the JADEP program. That's one. So we
mm,
have we have over 250 private pharmacies that are on the JADEP program now. So,
Mhm.
and I experienced the same
One
thing
in
with
each parish?
pardon?
Is there one in each parish?
Most definitely. The list
Okay.
is also, I mean, I printed out the list today, but it's also on our website.
Okay, the
And it's
250 list will
listed
be
by
long for us.
parish.
Yeah, the 250 will be long for us to list up this evening. But they may find
Right.
it on the website, the pharmacies, the JADEP, the pharmacies that accept the JADEP card. Or,
Yes.
or should we now say the NHF card? So the pharmacies that
Yeah,
accept.
we at National Health Fund say the JADEP program, but not
Mhm.
necessarily a card. So you have to ask the pharmacist if they're on the JADEP program, and that would indicate whether or not how much money you will pay. Because some pharmacists are not pharmacies are not on the program. So you have to be, when you're shopping around, you have to be smart. Even with your medication, you still have to kind of be smart about it and say, I know this pharmacy, they take the JADEP card. So that's where I'm gonna get my drug because
Mhm.
pay less. And what I also want to inform Miss McDonald is that if you are visiting a pharmacy and they don't have the drug, what you can do is to call our customer service rep. And I'm going to give out the number 906-1106. What we can do for you is to call, depending on your location where you are, in which parish, we can actually call around other pharmacies for you to locate that medication and then indicate to you that, okay, maybe X pharmacy stock is running low now for this month, but there's another pharmacy in your location or close in your location that you can get your medication, because we really and truly don't want our senior citizens to be out of their meds. So
Mhm.
that is the kind of customer service we provide, and I encourage persons to call us and not forced to buy the expensive drugs. So we will try our best to call the different locations and say, okay, this pharmacy has the medication, and you can reach out to them.
Okay, the questions are firing away in the chat, Miss Jones. So Miss Joan Pusey wants to find out. I think we did answer this one. What
Yes,
if you only have the NHF card? Would you get the JADEP drugs on this one also? So just
yes.
to
So you
reiterate.
want, yes. So if you have the NHF card and you turn and your birthday is tomorrow, which you reach 60 tomorrow, you will automatically get the benefits from the JADEC drugs.
Wonderful. Because the JADEP program is only for persons 60 and older.
Yes, yes, yes.
Okay, wonderful. I also want to pick up on the point as it pertains to the access to medical care. So at private doctors, though, the card will not apply.
The cards are not used at doctors' offices. The cards are only for medication subsidy. So you don't use the cards at doctors' offices at all.
Okay, okay, good, wonderful. So Miss Pusey says, thank you, much appreciated.
You're
Oh,
welcome.
all right, and Miss McDonald says she's in Montego Bay, so I presume she will be giving your office a call to find out how she may access her drugs. And we have another question, just to take some questions from our viewers before I ask any more questions. Mrs. Patricia Reed Wall wants to find out. She says I need thyroid hormone replacement medication to be placed on NHF list. It's a life-saving medication, Miss Jones.
We got a lot of requests for this. The Some of the medications, as I said before, they're on you can access them at the public drugstore pharmacies. They may not be on the NHF card program at private pharmacies. And some of the medications I know for sure to treat thyroid is on the government vital, essential, and necessary drug list, and you can access those at the drugstore pharmacies, the public sector pharmacies. So I would refer Ms. Patricia Reed Wall to try and see if it's one of those medication that is available at the drugstore pharmacy, if you cannot get it on the private pharmacy.
To piggyback on Mrs. Reed was question as pertains to thyroid medication, and we spoke earlier about those 17 illnesses. Are there any plans by the government to increase the number of illnesses that are covered by NHF? We see how the lupus community is now enjoying wonderful benefits. So are there any other illnesses that will soon be covered by NHF?
Well, from time to time, there is advocacy and there is request, and there are periodical reviews of conditions, and they looked at various areas such as the burden on healthcare, the impact, the number of persons affected in the population. They looked at costs and various variables. So from time to time, it is a constant review, and there is actually a form on the website that persons can fill out to make their requests and recommendation in terms of adding a condition or a medication on the NHF program. So I would invite. I'm actually going to just quickly jump on the website to let you know, but there's a form there that you can fill out to request for addition of medication.
While you jump on the website, I just want to ask this question because we are very much also about preventative care, right? And in communicating with the elderly population and seeing the number of illnesses that are among persons in this age group, what would you suggest to our pre-retirees to delay or to prevent some of those illnesses? Because healthcare is not cheap. And we also need to talk about solutions so we can prevent burden on self, of course, because it is indeed burdensome on the pocket. So what are some of the issues that you see coming out among our seniors in terms of healthcare and just undergoing certain illnesses that you would say to someone who is like a pre-retiree or pre-senior to prevent that from happening to them?
Okay, well, we work closely with the Ministry of Health and Wellness. As I said before, the National Health Fund is an agency of the Ministry of Health and Wellness, and I know the Ministry of Health and Wellness is driving a strong campaign in terms of healthy lifestyle and prevention, and looking at the risk factors for NCDs in general. So we work with them. We provide health checks, we do community outreach programs, and so it's really a partnership, and we work with some other health agency across Jamaica just to encourage persons to manage their health, to get the appropriate screening at the appropriate time, and not to delay. So we basically is pivotal in working with health agencies to help individuals to manage their health better.
And a lot of that, Miss Jones, would have to do with nutrition, right? And we know we're not going to even discuss that this evening, but does the health fund works with seniors to give them like nutrition advice in terms of management of their illnesses?
Well, actually, through our community outreach, from time to time, we will get a nutritionist on board to do presentations and talks. And that's how we work with the nutritionist. We, depending on a like a church or organization, might invite the National Health Fund at their health fair or their community outreach. And one of the areas that we can discuss and talk to persons about is definitely lifestyle and nutrition. And we can work with the Ministry of Health to get nutritionists on board to assist in that area.
Okay. There are a few questions that are coming in as pertains to particular drugs we can't get to all of them, but just one last one, just to mention from Miss Dorothy Wilson. She's asking, why is Galvus not on the list, a diabetic drug?
Well, what I will do, because I really and truly don't have the drug list now. The we have we have the drug list on our website, but I'm gonna write that down, Shellyan, and get an update for you, and I can just send it to you.
Thank you so much, and we'll
I
pass
will I
that.
will I will investigate that one for you, Miss Wilson, and get back to you through Shellyan.
But as you said earlier too, that there is a form on the website that persons can fill out if there's a particular illness that they would like to get covered, or if they can't get their drug, they can call into the NHF to find out the area where it's located.
Yes,
Just an
once that
addition
drug is on the government approved
proof
list,
list.
that's very important.
Okay. And just a commendation message coming in from Mrs. Reed Wall. She says the NHF registration process is the absolute best.
Thank
Woo!
you so much.
Well done to your team. All
Really
right.
appreciate it.
Good, good, good. Wonderful. Yes, our seniors are very honest, Miss Jones. They will tell you as it is.
I know, and we are open for the frank, comments
Feedback.
and
Hmm.
feedback. That's how we improve over time. So we welcome all the comments and areas in which we can address.
All right, so my final question from you would have to be with, just to inform our viewers again, how can they access their NHF card, because we're trying to minimize the two cards now, so it's preferably to have the NHF card. How can persons access the NHF card, and why should they get an NHF card?
All right. So accessing the National Health Fund card is the process is pretty easy. Persons who are diagnosed with any of the 17 chronic illnesses, they can fill out the NHF application form. One second.
Sure.
Fill out the NHF application form. The doctor is to sign it and place their registration number on it. And then once that is filled out properly, they can take it to any of the card centers island wide, and they can get the NHF card.
The NHF card, that is free, Miss Jones.
NHF card, that is free. That is free. All right.
Wonderful.
And the second half of your question is that why is it important? Because the NHF card actually helps you with purchasing your medication, and helps you with the cost of your medication. So you have less out of pocket money to pay, and we understand that if you're diagnosed with certain illnesses, you're being treated um, for life, really, and that cost adds up tremendously. So with the NHF card, it saves you some money, so you can have that additional funds to spend on other items. So I definitely encourage Jamaicans to apply for the NHF card and get it, so it can help you pay for your medication, and also to encourage persons to use if you are being treated at a hospital or health center, you can access your medication free at the drugstore pharmacy. I have family members who access their drugs at the drugstore pharmacy, and they don't pay any money at all. They don't pay.
Wow, wow. What a lovely note to wrap up on. They pay no money at all. So save, our seniors, pensioners, you need to save every penny that you can. So do get the NHF card. And just to state, if you are not able to get your drug that is on the approved list at your pharmacy, please do call 876-906-1737. 1106 and speak to the team at the NHF, and they can tell you where your drug is available. Thank you so much, Miss Jones,
Thank
Health
you so much.
Promotion and Public Relations Manager at the National Health Fund, for joining us on this golden conversations. It was indeed golden. We saw the comments.
Definitely.
Persons were very active today in our conversation. So we do thank you for coming on to provide those valuable information to our elderly population. Once more, we ask persons to just continue to keep it locked to Golden Designs. Every second and fourth Tuesday, we provide you with information that you need to know. Signing out from me, Miss Sharon Jones.
Thank you so much for having me today. It's a pleasure, and I really enjoyed the conversation.
And we are excited and happy to have had you in Golden Conversations. Take care, everyone. Thank you so much.
Bye.
Bye.
Okay. Oh.